Hi everyone, I'm going to discover the association between social determinants and health inequality through the study I'm going to talk about. This paper aims to assess the impact of the socioeconomic status on survival for 13 major types of cancers in the state of New South Wales in Australia. Socioeconomic inequalities in cancer survival has been reported in many developed countries, with patients from the most deprived areas showing poorer outcomes for many cancers. Possible explanations for these inequalities include differences in stage of disease at diagnosis and access to and use of effective treatment. Patients living in socioeconomically disadvantaged areas may have poorer access to health care, which may result in delayed diagnosis and poorer treatment. Researchers may have also reviewed two recent published studies that showed cancer patients in the United States who were uninsured or inadequately insured or significantly more likely to be diagnosed at an advanced stage for several major cancer and less likely to receive optimal care, so more likely to have poor outcomes. As shown in Table 1, there were relatively more breast and fewer lung cancers in the top SES group, while the opposite was true for the bottom SES group. As reported by other countries, mammography screening is probably the major contributor to the greater frequency of breast cancer in higher SES areas. Table 2 shows 5-year relative survival by SES for each cancer, for males and females separately. Women had better survival than men except for bladder cancer. And patients from the more disadvantaged areas had poorer survival for most cancer in both men and women. Low SES may be a barrier to receive timely, high-quality diagnosis and treatment, and there is evidence that people living in lower SES areas in Australia are less likely to attend for proper treatments and more likely to receive suboptimal therapy. This may be due to some lower SES areas being located in rural and very remote areas, where access to healthcare service is more limited and the patient need to travel long distances to treatment centers. Patients from lower SES areas are also less likely to have private health insurance, which can be a significant predictor to survival for cancers. There is some evidence from other countries that among patients with equal access to care, the survival disparities between different SES groups tends to disappear. It is also argued that patients from more disadvantaged areas were less likely to receive lung cancer surgeries. Patients living in lower SES areas are more likely to have chronic conditions and higher rate of comorbidities in patients living in lower SES areas may have played a role in preventing them from receiving good therapy. However, there is not enough data of comorbidity in this particular study. Lower SES have been also associated with a lack of knowledge of health and health system, and patients may be more likely to refuse or not to comply fully with therapies. The strength of this study is a wide coverage of cancer types in NSW, which was around 76% of all cancers, and ranging cancers from very poor prognosis to cancer with excellent survival. The analysis is limited by the allocation of cases to SES groups, using aggregated data based on where they live. It is possible that individual people may be misclassified at this situation. As SES is one of the most important indicator of health disparities, researchers argue that inequality in income means that not only for purchasing healthcare, higher incomes can provide better nutrition, housing, schooling, and recreation, and the distribution of income with countries and states has been linked to the rate of mortality. It is important to diminish poverty and distribute resources evenly. Governments should invest more in building healthcare network in rural and remote areas and encourage local communities to support health promotion strategies for individuals. Education is perhaps the most basic SES component since it provides knowledge and life skills that allow better educated people to gain more ready access to information and resources to promote health. Health sectors and individuals should understand the role social determinants play in individual and community health and strive to implement public and social policies that reach the largest of people while targeting the day-to-day needs of individuals in their communities. And thanks for watching.